In anatomy and in healthcare settings, one must be precise. So if one was working with patients and there was an instruction to move something farther to the right, who's right? The patients, the physicians, if there are multiple physicians, the one that was talking. And so, therefore, it is just then assumed that any direction such as left or right are referring to the patient, not the observer. And an extension on that would be when one asks about the position of the body, one assumes that the patient, or at least the reference point, is what is known as anatomical position. In anatomical position, a patient is standing, their arms and legs are extended rather than flexed, their feet are flat on the floor, and their legs are spaced a little apart, and their palms are facing forward. In other words, their forearms are pronated. This is what is known as the anatomical position, and it is then just assumed that when one speaks of the body, that this is the reference that one is using. When one thinks of the positions of the pinky and the thumb, which one is medial and which is lateral? One might respond, that depends on how one is holding their hand. But the correct answer would be to assume the anatomical position, in which the pinky is on the medial side of the hand and the thumb is on the lateral side of the hand. When one studies the bones of the forearm, the radius and the ulna is on the medial side of the arm, the radius is on the lateral side of the arm. Now, clearly, this could change when one changes their arm's position, but in answering the question, you assume the anatomical position. When one refers to muscles and actions, one can use the anatomical position once again as the reference, in which, say, the arms are extended, and then muscles known as flexors would then to move the body from the anatomical position and flex the arms, and then a muscle, an extensor, would then return to anatomical position.